Hello, welcome to this Straight Talk video about the OET 2.0 writing subtests, featuring a few hints and tips that can help guide you to focus your approach in preparing for the writing paper. For those of you not already familiar with the OET writing task in the 2.0 version, you are asked to write one letter. So it's one task, and this letter is a professional letter that may be a discharge letter, a summary of some sort, or a referral letter. The advantage of the writing paper is that it is profession specific. That means that if you are a doctor doing the OET paper, you do the writing task specifically for medicine. If you are a nurse, you do the writing paper for nursing, and so on for all 12 specialties of the OET. The disadvantage of the writing paper, or the biggest disadvantage, is that for many of us, writing a letter of this kind, a full professional letter by hand, is something we are just not familiar with doing. We've never done it before. Because in this day and age, the computer controls everything. It's a computer format. You just pull it up, you put in the information, and off it goes. Or it is a set letter on a piece of paper with the framework there, and you just fill in bits of data, and once again, off it goes. So what is OET testing, really, with this kind of task? Essentially, they're testing your ability to understand patient information. They're testing your ability to think critically about that information, what is important, what is not important, and what it means. And they're testing your ability to express yourself clearly and appropriately in writing in English. So what are the big points that you can use to help focus your preparation for the writing? I like to tell my candidates, think about it as understanding the patient notes, understanding the reader, and understanding tone and format of a professional letter. So let's take these each in turn. You can approach them in any order you wish because they are all important. But I'll start with understanding the patient notes. In the first 5 minutes of the writing paper, you just read. You're not allowed to write. So how do you make sense of all these patient notes and information about the reader? I like to say, simplify it. How about using the W questions? Who, what, when, where, why, which, and how? Who's the patient? What is their diagnosis? Why were they in your care? What happened during the time they were in your care? When did they come? When did they leave? How were they treated? And which problems need to be followed up when they leave your care? If you can answer these simple W questions as you read the patient notes, you are well on your way to making sense of what is going on. Let's now look at understanding the reader. The reader of your letter could be another professional. It could be a nursing care facility. It could be a relative or the patient themselves, or if you are a vet, the owner of the animal. So you clearly understand that not all information is appropriate for every kind of reader. There'll be highly technical information that a relative doesn't need. There'll be lots of social background information that, say, a surgeon or a neurologist don't necessarily need. So your task is, once again, to read the patient notes understand details of what is going on, think critically about the reader and what information is important for them. Lastly, tone and format. For many of us, the only writing we do in communication is to friends. So the question is, how does a letter to your friend differ from a professional letter? If you don't know, go online. Find examples of letters to friends and acquaintances and compare them to letters in a more professional setting. Does not have to be medical. You could, for example, look up job application letters. Compare the two. How is the letter addressed? How is the information organized? Is it all jammed together, or is it separated in sections with specific information in each section? How do they close the letter and say goodbye to the reader? These differences will help you to understand exactly what kind of presentation your professional letter should have for your OET writing task. And now that I think about it, I'm going to add a fourth point, and that is grammar and vocabulary. I know. Learning grammar is so tiring, and learning vocabulary is sometimes quite painful. But OET is looking once again at your ability to express yourself clearly and professionally in writing. So vocabulary and grammar are important. So I hope that was helpful. I'll see you next time. Bye. If you found this tutorial useful, subscribe here, then head over to our website promedicalenglish.com for more medical English courses and free learning resources.